Hi, my name is Marcus Heisner, and today I'm going to be going over some muscular fitness tests, specifically a push-up test and a curl-up test, and I'm going to be having Alejandra demonstrate those tests, but before that I'm just going to go over the proper form for the push-up test, which we'll be doing first. And there's two ways to do it. One way is with the arms under the shoulders, hands under the shoulders, and your feet, you're holding yourself with your back straight, and then from here, you're lowering yourself by your elbows until your chin touches the mat, and then you're straightening to a straight arm position, keeping your back straight the whole time, and you don't want your hips or stomach to touch the mat. And then the other position is a modified push-up, and it's the same position, back straight, hands under shoulders. You don't want the hips to touch the ground, but your knees are in contact here and the feet. And so you lower until the chin touches the mat and come right back up. Don't want the stomach or hips to touch the mat. So we'll have Alejandra demonstrate the modified push-up position. And she's just going to do as many as she can until she loses form or is unable to do it. 1, 2, 3, 4. Make sure the back stays straight. Alright. And now we're going to be doing a curl-up test. And for the curl-up test, we have 12 centimeters measured out here with tape, and I also am going to be using a metronome, which is to the beat of 40 beats per BPM. So that will be the rate in which the curl-ups will be done. And now I'm going to demonstrate the curl-ups. So what you'll want to do is be in the supine position, so on your back, and you want your hands flat, head, shoulders, and hips and feet in contact with the ground. And the tips of your fingers want to be starting at the tape. And then at the beat of the metronome, you're coming up, touching the end of the tape, and then going back down. So it would look like so. Keeping your back straight and neutral the whole time. You wouldn't want your feet to come off the ground, or you don't want to not reach the end of the tape, or you don't want to reach it with just one side. You have to have both go to the end and both come back to the beginning. And the test will be concluded when she doesn't keep up with the metronome or doesn't keep form. So we're going to have her perform that test now. So lying on the back, hands at the tip of the tape, and then from here, I'm going to put my fingertips at the edge of the tape so she has a better cue as to where the positioning is. So as soon as you're ready, go ahead and go to the beat of the metronome for the curl-ups. Good. 1, 2, 3, 4. Make sure you're breathing. 5, 6. Inhale as you're down. Exhale coming up. 7, 8, 9. Inhale. 10. Exhale. Inhale. All right. That would be it. Thank you so much. I hope you have. And that'll conclude the test for today. Thank you so much for your time. So for the conclusion of the fitness test, we're now going to be taking the heart rate and blood pressure. So if I could have you have a seat here and pull up the jacket. Thank you, that's about good. And then you could just leave the arm rested. I'm going to take the heart rate first for 30 seconds at the radial pulse, starting now. Alright, so I got 42 in 30 seconds, so multiplying that by 2 would be 84 beats per minute. And now we're going to be doing the blood pressure. And I'm sorry I don't have my manual blood pressure cuff and stethoscope. I don't have access to it right now, so I have an automated blood pressure cuff. So I'm going to be taking the measurement there. Just keep the arm relaxed. If I could have you move up to see the reading. And we have a reading of 127/82 with a pulse of 80, which are really good vitals. And I appreciate your time and hope your day's going well.